Hey, Dr. Cleveland, how's it going?
It's going well. How about you, Jake?
Really well, all things considered. It's been a crazy few months, but overall very thankful for what we've been able to do and just, you know, been able to survive and keep going and trying to do what we can. So obviously, you're the founder and owner of Marching Health. What exactly do you guys do?
Yeah, our goal is to provide health and wellness education and performance training for the marching arts and to help young people and staff and directors understand the athletic demands that their members are going through. If you've been around the drum corps activity the past few years, you know the ridiculous amount of work that these students are doing and that it's nonstop. And there's so many factors that go into their performance from a physical perspective and a health perspective that we want to make sure they have the best information to be able to perform at the highest level. So we go and we do clinics with marching bands, drum corps, and WGI groups all over the country. We make sure that they have the best injury prevention workouts for them and marching specific performance workouts. And we tackle all the big health topics like sleep, nutrition, hydration, heat tolerance, proper shoe wear, and anything you can think of, we try to make sure we hit. One of the big things we've been exploring now is working with the sports psychologist and talking about the mental health side of things and the mental.
Yeah, that's a big deal these days. You know, it really kind of brought to light. I mean, it's been a problem for forever, but I think we're just kind of now coming around to realizing it and kind of recognizing it as part of the whole health package. What does a clinic look like? So say a band's like, yes, we want to kind of take this more seriously. We want to make sure, you know, the health and wellness and athletic training, all that is kind of taken up a notch for our band. We bring in Dr. Cleveland or someone from his team. What then happens? What's that day look like typically?
That's a great question. We have a couple of different packages that we typically do. And in an ideal year, it's in person. And we usually spend at least half of the day with the band. Half of that time, so about 2 hours of that time, is devoted specifically to training the leadership team, how to run our workouts and health and wellness programming. Because I was really poured into as a high school student section leader, and that made a huge difference in my life trajectory. So my goal is using health and wellness and using music to be able to give that back to the student leaders all over the country and make sure that they have something tangible every day when they show up to rehearsal.
You mentioned that, you know, obviously these are designed to be in-person clinics. How did you guys adapt? Because I'm sure you had about a week to figure out how your summer was going to be different based on quarantine and the other safety measures that have to put in place. How have you guys kind of changed your model temporarily, I'm sure, to make it work for the summer?
Actually, we started this last year where we would do virtual clinics to help bands cut costs. So bands that knew they wanted to do something for their students and knew that we had the right system that fit what their need was, we did virtual clinics if they couldn't get us out time-wise or couldn't get us out budget-wise with the cost of travel.
That's awesome. Well, if people wanted to jump on and be a part of this and they wanted to kind of take their physical performance to the next level, where can they find you over at Marching Health? How can they get involved? How can they get started?
We're on all the major social media platforms, Facebook, Instagram, Twitter, even TikTok nowadays. You can shoot me.
We have not gotten that far. We are not on TikTok yet.
You can shoot me an email as well or jump into the contact section of our website. Elliot, ELLIOT at marchinghealth.com.
All this stuff is on the screen too. We're gonna put text. It's here or it's here. It's somewhere.
The fastest way is probably to just DM us on social media, and then we'll take that conversation from there.
Awesome. Well, Dr. Cleveland, thank you so much. Love what you're doing. Very appreciative for your work in the marching activity. And are you going to stick around and watch the show?
Absolutely. I got
all right.
on the red.
Over there. Thank you so much. Take care.
Thanks.